The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thanks for joining. We're going to get started in just a few minutes. All right, now that it is 12 o'clock, we're going to go ahead and get started. But first, if anyone is having any hearing issues, please indicate so in the chat box on the right of your screen. Okay. Hi, everyone. Thank you for joining today's webinar. This will provide an update on the current automation landscape for healthcare organizations. Today's program will be presented by Fabian Williams of Withum, Smith & Brown, Michael Schultz, and Jesse McHargue of Nintex. Before we begin, I have a few notes. At the bottom of the toolbar, you will see a chat box. Feel free to send us your questions during the presentation. We will do our best to address them after. There will be 4 polling questions at the end of the program. To qualify for CPE credit, you must participate in each poll. CPE certificates will be emailed to you within a few weeks. And finally, once the webinar is over, there will be a pop-up asking you to complete a survey of today's webinar. Please take a moment to complete it. It is our way of being able to provide you with the best and most relevant programs possible. With that, I'm going to turn it over to Fabian.
Thank you, Rachel. As Rachel mentioned, there will be CPE credits provided at the end of this course. And one thing I wanted to bring up here is that the completion, participants should be able to do these 3 bullet points that you see here on the screen. The entire session and recording is going to be around healthcare and process automation. I wanted to make sure that we provide an agenda so that we can basically keep track of where we are and what we're going to be discussing here today, and give you a very large, 10,000 feet view of what we're going to be covering. Our agenda is pretty much loose, but it's going to follow a theme, and the theme is going to be the relevance of process automation as it relates to the healthcare industry. We're going to talk about the documentation and the importance of documentation around process automation. Then we're going to look at how process automation basically takes something that's somewhat abstract and bring it into your own reality, because in the end, you're the one that's going to be doing an activity and automating it. And we're going to take a look in terms of just the shifting of the industry, in terms of how people work today, and the confluence of digital process automation and the advent of robotics process automation. And finally, we're going to talk about what is a bot. We're hearing a lot about the bot industry, bots doing a lot for us, so we're going to dive a little bit into that. And in between all of that, we're also going to do a live demo, particularly looking at the healthcare industry in terms of how that applies to you in terms of process automation. Hopefully, at the end of this, you basically get a good example and a good match of what automation means to you in the healthcare industry. I'm going to allow all of us to basically give a brief introduction about who we are, what our domain specialty is, and then we'll dive right in. As Rachel mentioned before, my name is Fabian Williams. I am a director of the digital process automation practice here at Withum Digital. I am a Microsoft MVP. Just means that I go around, evangelizing for Microsoft and answering questions all over the world. I do have over 15 years of experience in consulting, development, and training for Microsoft technologies, specifically around business process automation, electronic content management, such as SharePoint, and nowadays in the cloud technologies of Microsoft Azure. Michael?
Great. Well, good afternoon. Thank you, Fabian, for including us in this. We're super excited. My name is Michael Schultz. I am responsible for product and field marketing globally at Nintex. I'm relatively new to Nintex, but I've had a pretty extensive background in enterprise software and workflow automation, and I'm really excited about the topic today.
Excellent. Thank you, Michael. And Jesse?
Hey, afternoon, everybody. My name is Jesse McCargy. I'm a technical evangelist here at Nintex, which means I just really talk about the products a whole lot. Before joining Nintex team, though, I was on the customer end of things. So I was the guy building out the workflows, the forms, and doing all the process automation. I worked in a variety of organizations ranging from retail to civil engineering to utilities as well. So happy to talk to you guys today and see how we can address healthcare.
Absolutely. So I want to say thank you very much for Michael and Jesse for joining us today. And the reason why they're here and the value that they bring to this conversation is here at Withum Digital, we're a consultancy agency in a tax and advisory capacity. And Nintex are some ISVs, independent software vendors. They create a product that actually does digital process automation and also robotics process automation. Hopefully, having us here provide this webinar to you will give you a perspective of not only what we see in the field, boots on the ground, actually speaking to people in the healthcare industry around process automation, but also provide you with a larger, wider gaze in terms of what Nintex provides by basically the author, the builders of this software. So while we're going to be somewhat agnostic in terms of this technology and as we speak to it today, one thing I want to emphasize is that the reason why Nintex is here is because they are best of breed. They bring a lot to the table, and they're going to give you some examples of what they see along the lines of how I relate that to my customer interfaces. So the one thing I want to start off with is this wonderful statement by W. Edwards Deming that says, if you cannot describe what you are doing as a process, you do not know what you are doing. And that's somewhat analogous to another statement that Albert Einstein actually said, that's basically, if you can't explain something simply enough, then you don't understand it. But as it relates to process, you want to be able to ensure that you can describe to someone else sitting next to you or someone else coming into an organization brand new what you're doing and the purpose of that, so that they can basically be successful and effective as well. One of the things that's very striking, and hopefully at the end of this year today we can flip this number, is that 75% of enterprises do not feel process management is understood or addressed in their organization, and that's really a critical number, because that means that 3 out of 4 people, even though they're participating, in a process, and let's use the example of healthcare, 3 out of 4 people don't understand how process management is in their organization. And the way I want to look at that a little bit is by looking at the workflow actors. Since we're talking about people, I'm just going to leave this here and just speak to the slide. Particularly in the healthcare industry, but in any automation, human beings have just a very, very few ways in terms of how they can, process an activity. Right? You can vocalize it by speaking into something like a Dragon Naturally Speaking or some type of dictation program. And even in modern day technology, you have natural language processing where you can speak and it'll understand and move forward. But if fundamentally we're limited to our fingers, right? So in terms of typing. So typing is the means by which we can get input from a human being into a system or related to other individuals. And when you're talking about human beings, me being part of that species, we have to understand that there's going to be a part where fatigue plays a role. When we may wake up refreshed and we may tackle and we may charge the mountain and we may do quite a bit, but there's going to be some point in time where there may be some point of diminishing return as fatigue sets in. And also, human beings can sometimes get distracted. There's people go to work, but life certainly happens, and we have to be mindful of that. And taking that into consideration, sometimes people may be, they may be, energized and they're very, focused, but something can happen, slightly that may distract for a little bit, and that distraction can cause an error. So when you're looking at the statistics of it, human beings play a major role in terms of just how effective a process automation is. Now, looking at that, and I'm going to ask Michael to jump in here in a second, give us some perspective, his perspective on this too. But a process, when we'll just look at the human being, a process affects every area of a business. And where you see this most effectively is in procedures like your standard operating procedures. You see that in assets in terms of your digital footprint, in terms of what you're working with. And relating this now to a healthcare, from a process standpoint, you can consider yourself in an emergency room in a triage situation. There's a process around that. In terms of assets, there's an intake in terms of how you want to have people walking into the door. You have a patient intake. You may also have then a triage, and then you have basically a diagnosis, and you have a doctor come and see them. So, and all of that involves assets, filling out a piece of paperwork that's going to follow that patient around. And you know how important that is to basically get it right the first time. And obviously there's the people, right? There's the patient walking in. There's the ER nurses and ER physicians, and then there's the the generalists in terms of the doctor. And in all of that, you also have a reporting element of it as well. And the reporting basically brings all of that together in terms of ensuring that you can document and you can track and you can measure the entire process of that coming in. Before I get into this, Michael, I just want to chime in terms of here as well. We're talking about human beings and systems.
Totally. I loved your stat, Fabian, on 75% in the slide before, and I think that matches very well some of the other studies. McKinsey had one recently that had a little more than 2/3 of all processes are not just undefined very well, but they're actually fully manual. And I think that's very consistent with what we're seeing in healthcare. So the combination of the process and a lot of things being manual are exactly why we're having the webinar today. And I think and we'll talk a little bit of this as we go through, the ability to be able to manage, automate, and then optimize really becomes a key motion for a lot of organizations.
Absolutely, I couldn't agree more. And as you talk about optimization, and one of the things I want to, in line of the procedures and the assets and the people and the reporting, and pivoting this back on the healthcare industry more specifically, one of the things that's very important as you work in the healthcare industry, especially around process automation, is ensuring that you have compliance. Right? Compliance is key. Compliance can, in some aspect, may cost you money in terms of fines. In the extreme, it could cost, affect your freedom in terms of, going to jail for some things. So when you're thinking about compliance, some of the things that comes, top of mind are basically PII, personal identifiable information. That is something that you want to make sure that you do not, time and time again, and I allow Michael to chime in here as well. You see people in the news where they're saying, okay, there's a data breach, PII information released in the wild, and people, have to go ahead and do things that they don't want to do, and put protections in place, to make sure that it doesn't happen again. How good would it be to make sure that you are locking down and you're thinking about PII, top of mind immediately? And also from HIPAA, the Health Insurance, Protection and Portability Act. That is another key part in terms of not only privacy component of HIPAA, but also to ensure that that the reasonable sharing of information between patient and doctors and pharmacists, doctors and other doctors, is maintained. In terms of accessibility, you want to make sure that that is also there as well, and real-time relevance. Real-time relevance is certainly key in terms of the healthcare industry as well, right? You want to make sure that when it comes to assets, you have the information entered properly the first time, but also as especially in a triage situation when you're trying to diagnose something quickly, because it may be a life-saving technique, you want to make sure that information is readily available to people in terms of the assets on different devices. And we're going to get into that a little bit later on. in terms of the different type of devices and how you can basically orchestrate that moving back and forth. But all of these are key important features. And that's on the right-hand side of what we're looking at. Behind all of this is governance. And governance is certainly a very important factor in all of this. You want to make sure that there are controls in place and that there's a process in place and that people are fully aware of what's going on. And if you're from an administrative side, attending the webinar today, you are basically a CIO, you're speaking to CIOs and people who are responsible for putting these systems in place. ROI is also key, right? And ROI is important because when you want to make sure that, if you're introducing a new technology or a new way of doing work into an organization, that return on investment is, it can be tracked, it can be realized, as quickly as possible. I don't know, Michael, if you had anything to jump in here with.
Yeah, I think just real quick, I think one of the exciting things is Jesse's going to show a quick demo as we go through it. I think we'll bring some of the things you just talked about, Fabian, to life in terms of being able to really map to the compliance, the governance, the improvement, and the efficiency. So I don't want to steal his thunder, but I also do think from a platform perspective, as we talk a little bit more about Nintex, the ability to really make sure that things are secure and compliant is something we care deeply about. Yeah,
it's a great pivot, actually. I'm going to actually let you lead off here and just talk a little bit about process management, automation, and optimization. From your perspective, how you guys at Nintex view this, and how you can explain that to the people on the webinar.
Yeah, absolutely. And I love when things can come alive, and so I'm just going to touch on this real briefly and let sort of Jesse kind of highlight some of these things as we go forward. But it really is three core areas that we talk to customers all the time about, that it's really about how it's no code, very low code, power, ease of use. And it really is centered around three things. It's how are you managing your processes, how you automate, and then how you optimize. And within each one of those is some real power that we'll talk through as we go throughout the webinar, whether that's mapping the process, which I think we're talking about very shortly, whether that's RPA, whether that's overall kind of document automation. And so all that really is super, super key, I think, particularly in healthcare, but really across any industry.
Quite right. Yeah, and you're right. The one thing that I cannot emphasize enough is that even though we're basically focusing on healthcare here today, process automation is ubiquitous. It's all over. I usually tell people when I engage with them that if you just wake up in the morning and you get up out of bed and you go freshen up and then you go in your car and you go to work, that's a process. Everyone has a process, and and this matter that this process is just aligned to your business, what you're being paid to do. But no one goes through life without some process.
I don't know. I may be. I think I'm gonna have to struggle with that one. But I think I need to develop one. But I agree with you.
Exactly. So just to touch on some of those points a little bit more granular, and again, just speaking somewhat in the abstract here, and going back to that finer point of if something is not documented properly, then you don't know where it is and you can't really explain it. The first thing out of the gate, regardless of the technology, regardless of saying that we're going to do Nintex, we're going to do something else, even before I talk to a customer about the technology, oftentimes when I engage with them, the first thing I say is, okay, fine, describe to me what we're dealing with here, right? And oftentimes the way that looks, if you're trying to visualize this, I'm inside a room, there's a whiteboard, and I'm speaking to a bunch of subject matter experts, or I'm speaking to some stakeholder, and maybe sometimes even users, and I'm saying, okay, tell me about how you get, where's your starting point? Is there something that triggered the starting point for it to happen? Is somebody picking up a phone, somebody basically getting an email, something being faxed in? How does it start? And then from that, how many hands is it going through? How many different roles are there? And I basically start, it could be somewhat manual on a piece of whiteboard or a chalkboard, and I'm drawing this out. And in the olden days, we'll categorize it that way. You're using something like Visio or even mind map. But the key point here that we're trying to emphasize, especially in this webinar around the documentation piece of it, is that we want a living document. And this goes back to the governance I spoke about earlier, where governance is basically a cycle, and the document and the living document in terms of documentation is also a cycle. It may certainly start out with someone like me or you on the phone here today in this webinar, documenting a process, writing it out. But wouldn't it be nice to have that document, be persistent and be always there for you, and can also capture information at various points in the cycle, and also provide this information to people just coming in. A couple of the bullet points that you see right there, and one of the things that this does help with is domain knowledge and corporate, and corporate institutional knowledge as well. Sometimes people move up within the organization, sometimes people move out of the organization, and the risk there is that they take that domain knowledge with them. Wouldn't it be nice to have this documented as such that you don't have that problem? Demonstrate cost and accountability. One of the things that you can certainly do, and you can see here on the screen as an example, is that within each bucket of work or task or activity, you can basically associate a cost. And the way you associate the cost is that there's going to be either a system doing something or a human being doing something, and that human being, comes at the cost. There's either billable hours or there's the cost that you're paying this person, and you can equate that to an activity in terms of how long it takes them to do something and the wait period between each time. So you're able to, and this comes back to the question about the ROI. You can measure that ROI here, even through the documentation, before you go too far. And of course, it's certainly a sign of efficiency. The next thing is ensuring that you can have feedback. Now, we live in a world today that is very customer driven, and and depending on who you are, in which hat you're wearing, you often switch that role around. So let's say that you also are documenting this inside your organization. Soliciting feedback, the technical term for it is socializing. If you want to socialize the document you're building, that's very important, because it allows you to not live in that bubble. As you're designing something, you basically have your perspective of how you want things to run, your own idea in terms of how you view the process. But if you basically share this out to someone else, they can basically say, you know what, there's an opportunity for improvement here, or here's how I do it, or I totally agree, or I totally disagree. And having that person be able to annotate that by stars in terms of 1 through 5 and providing some contextual notes is certainly important, and it allows that document to have certain key relevance inside there. I'm not sure if you guys had anything to add to that, but that's one of the things that I think I really take away from the documentation. No? Okay, all right.
Yeah, no, I mean, I was just going to add, I think that the notion of sort of the living document collaboration is, I think we see that all the time, is how many people think that they know the process, but when you ask them, everyone seems to have a different perspective. And so that really, that ability to bring it all together, have people collaborate, work on change, is super powerful. And then the ability, then I think we'll talk about, is be able to take that and be able to turn it into an actual working workflow and process. That's something that I think too many organizations just do not start from that point of view. They dive right in, and they're missing a critical piece.
Exactly.
Yeah, I also think too, it's worth mentioning it with kind of the collaboration side of it. It also helps it to get in front of those that are actually doing the tasks, right? That so many times it's organizations kind of set the mandate of what the process is, but they're not the ones actually doing it. So it's always good to get that feedback from kind of those frontline workers and frontline users, the ones that are doing it day in and day out, on how they can improve upon it and actually build towards perhaps even automating that process.
Exactly. And these are, the one thing I always say that, the minute you create a process, and again, us being the consultancy arm of, of process automation, this is something that we see all the time. And it's something that we go back to our customers and we have conversations around. The minute you engage us and we build something for you, we test it, we deploy it, we put it in the field, and it's now a version 1 product. When we walk through that door, yes, you have this documentation and it's alive and it's working, which is good because you have that to go back to. But I guarantee you, it's starting to evolve, and the ability to map that evolution, once we leave and come back in, the process is already, showing signs of maturity, and that's what you want. You want to be able to capture these opportunities where you can improve upon it, because what you have as a vision in terms of what the stakeholders say, this is the mandate, as you said, Jesse, in terms of this is what we want to achieve. When you put that into the frontline workers, they may have efficiencies that you never thought about because they're the actual person doing this, and being able to capture that is key. And the point that I want to emphasize on this slide right here as well is that getting telemetry and metrics is also important, because you can basically judge to see how well something is doing out there in the field, how many processes are published, how many out there are actually working right now, and how many are out of date, and what's the rating on it. Because those star ratings are important metrics in letting you know, is this something that my users want, and are they using? Why spend so many time building something if the star rating is 0.1 when you have something going gangbusters at 4.8 or 3.8 in this example? So knowing what's working and not working is certainly important, and having this metric available to you is going to be certainly key as well. Now, that talks about the mapping piece of it, the documentation piece of it. Now, once you document it, and I know Jesse's going to be doing a demo later, and again, just like Mike, I don't want to be stealing his thunder on some of these items, so it's going to be somewhat cursory, is that the ability to pivot from what you're building in that documentation as you build it, and then move that into a working workflow is key. It's critical, right? Because you don't want to repeat something from one place into the next. So the ability to say, okay, I'm going to document this in real English that I can present and speak to someone in a mapping tool, and then have that create, or at least scaffold out, a workflow definition, and then basically as you would explain to somebody, just click and drag and move things and fill things out and build a workflow that people can understand, is certainly key. And any tool that you're using, regardless of the vendor, today we're talking about Nintex, but anyone, you want to have some assurance that it's easy to use and it's not a distraction, and people don't have to relearn things. And the way that they're working right now, it's just a matter of just extrapolation of saying, yep, this plugs into here, let me configure it, this plugs into here. And you want to make it very easy and seamless, and also integrate into the line of business systems that you're using as well. One of the things, and I'm going to certainly solicit some feedback from Jesse and Michael here, but one of the things that's very important, especially around healthcare, is this, and I'm going to pose it as a question just to start off. How often is it that you go into a doctor's office, or go into an emergency room, or to a hospital, and gone are the days of them walking in with a folder and they're writing stuff down? Oftentimes you see doctors and you see these healthcare practitioners, they have tablets, they have phones, they're wheeling in a kiosk type computer, and the information that you provided out there in the very beginning from the customer intake is available to you. They're not retyping stuff, they're not making any mistakes. Intelligent mobile process optimization is key. It is the way we live today. A mobile device plays a very important and integral role in terms of how we operate. And the ability to have fidelity between what you're mapping, the workflows that you're creating, and how you interact now as human beings in terms of having these different form factors able to help you is key. Now, from a customer standpoint as well, I know from me, in terms of just my healthcare system, I can basically use my iPhone and well, basically my Apple Watch. I can basically click my little heart button, get my my EKG going, and I can send that directly to my doctor from my phone. So having a process that will be able to basically pick that up and then move that to my doctor, especially if it does it on its own because of a fall or because I'm exerting too much energy on a run, that's certainly important, and that certainly plays a role. So I don't know, Michael or Jesse, if you have anything to talk about just the advent of mobile in this space and how that lends itself to this discussion today.
Yeah, I definitely, I definitely see that, and it is absolutely true. Even in healthcare, I have 5 kids, and going to the doctor's office with 5 kids at any time is always a joyride. So I appreciate the fact when the doctor can come in with all the charts and all the up-to-date stuff just on a tablet, and to be able to go through that and be able to get in and out. Gone are the days of having to go in, fill out a clipboard that you filled out 25 other times on every other visit, just to kind of confirm that everything's the exact same, and have to go through the process with the nurse and then finally to the doctor. Right, it's just a matter of going in. The doctor can get right into the patient. In this case, my kids be able to address the issue and then keep moving. Again, you're kind of talking about how it's a process, and that's exactly what it is, right? The process ultimately that we need to do is address the patient, right? And we want to be able to optimize that and get down to the root of it, and kind of get them out the door. So hopefully they can, help other people that are waiting.
Absolutely.
Yeah, Fabian, just to chime in, I loved your EKG example. I'm worried now about myself, but and saying to the doctor. But I think that really blends itself well to, I think, what you called out here for AI, is that the ability to be able to, where people are, taking information and then have intelligent process built up based on the responses, makes all the difference in the world. It cuts down obviously on steps. It's a lot efficient, but it actually does a really good job of just making people healthier or making process work better. And we could not do that without really the multi-screen approach that you're calling out here.
Exactly. And just to tie this all together before we start to actually, because the next step is actually to do the demo. But as I mentioned before, I'm really thankful that Nintex is here on the call here with us. But even in the abstract, if we're talking about documentation, creating these workflows. One thing I didn't really call out, which is important, is the signage of that. So how are you signing this? So sometimes people say you need to have a wet signature, but that's really going away right now in terms of the ability to actually sign or annotate on your phone or annotate on a tablet your signature. So you don't really have to print and kill trees anymore. There's now, that green aspect of what you're doing, telemetry. And also, we haven't talked about bots as yet. And that's going to be the second part of after the demo that we're going to get into. But having the RPA, the robotics process automation, is going to be really that next step or the next evolution. Because everything we've talked about so far is stuff that you probably do already. Now, the next step is how we can basically improve upon that with RPA. So what we're going to do next is actually jump into a demo. So Jesse, I'm going to go ahead and make you presenter here. Let me right click and say make presenter. And this should pivot over to you. Yes.
All right. Let me make sure I'm doing it right here. Okay. Are you guys able to see my screen?
I am.
Excellent, excellent. All right, so I'm not gonna take up too much time going into all the demo stuff, but I definitely want to kind of start connecting the dots and actually putting the tools actually to work, right? And we're talking about kind of the patient intake and that aspect of it. And so with Nintex, you can actually build out a relatively simple or even complex form very quickly based on just a few parameters that you want to collect, right? You think about every time you go into a new doctor's office. Again, I have 5 kids. I actually recently just moved. My wife and I had to find a new pediatrician, and we had to go through this for 5 kids. It was a mountain of paperwork that we had to go through. And it just kind of shines to the light of how nice would it have been if we could have just done this digitally, right? Maybe even at the comfort of our own home before we even get to the doctor's office. That would have been great. So things like this are really going to be able to improve on that process. And I'm not going to harp on the idea around creating a form, or I'm sorry, filling out the form, right? It's pretty simplistic, first name, last name, our email address. But the really nice things where Nintex really shines is, one, this is responsive form. So this is a responsive technology, which means I can create a single form and I can access this on my PC, on my tablet, on my phone. I can make this publicly available. I can keep it internal for internal use if I needed to. We give you that flexibility, right? So you only have to design and kind of cater to one form for what you want to do. Also, too, we can set up very easily our rules and validations around our forms, right, and around our controls. So our phone number, right, we just don't want any old information in our phone number. We want to make sure it's an actual legitimate phone number. So if I start typing my letters in here, I can't type letters, right? But if I start typing numbers, well, now I can actually do that, right? So I can come in here and type in my phone number, and I'm off to the races, right? I'm already providing some intelligence into my form with just some very basic setup. Multiple pages, right? Talking about medical history. Again, this is all very easy, all very similar. So being able to type all this out is very simplistic for the end user. And then lastly, right, Fabian kind of touched on it, the ability to grab that signature on the fly as you're filling out that form. They're filling this form out. perhaps they're at home, perhaps they're waiting in the office, they can come in here and just simply click on this and they're done, right? Now we've captured their signature, they've signed off on their consent, and they're good to go. But kind of pulling back the curtain, all of this is a really nice form. This is really well polished, and you're probably sitting here thinking you got this already kind of pre-baked, right? It's one of those cooking shows. It's already pre-baked for you. I actually want to jump over into the tool and kind of show off a little bit just how we actually did that magic. So this is our Nintex Workflow Cloud platform, right? This is our automation platform that we offer. I can create a form on the front end of this, but we can certainly connect to other systems such as like Salesforce or any other CRM, OneDrive, things like that, where we can kick off your processes. Think about how many times you get an attachment that gets dropped into a file location and you want to kick off a process. Well, we can certainly do that, right? And then from there, it's really about kind of connecting the dots, right? Going back to what we were just talking about, what is that process? What is that overall process map that you've defined using Nintex ProMap and being able to automate that? And it's really just about dragging all of the actions into it. So I want to generate a document after this, right? So they fill out the paperwork. We now need to generate the document to make sure we send it to them so that way they have it for their records. I can take my document generation action, drag it over into the canvas, and now all I have to do is configure this, right? This is simple, easy to use. It's a no-code, low-code solution. So I can hit the ground running as soon as I start building this. Also, too, kind of talking even further is, well, this is great for when I want to build a new process, right? But what about all those forms that I already have out there, right? All the forms that we've collected throughout all the years of being in business, all those paper documents. Well, the nice thing is Nintex offers an RPA solution. And an RPA solution, I can take that and have a bot look at a file, right? I can have it do some OCR on it, scrape the data out of it, and then I could have it send over to the form for me, right? I could have the bot enter in all the information, right? And then that way there I'm updating the same system of record. I'm going through the same process that we've defined, and we're having the bot do all that manually enter. So that way there we're not taking our users and we're not forcing them to do data entry for endless hours. And then we have to worry about all those compliance issues that Fabian was kind of mentioning, right? Are we leaking data somewhere? Is it accurate? Right? Did we miss something? And we can set up the system, we can set up our workflows to identify those. If we're missing a signature, or if we need to reach out, or perhaps there was something in their medical history that we now need to notify them about, right? We can certainly go off and do that. So I definitely want to hand it back over to Michael and Fabian, so that way we can continue the conversation around the rest of the Nintex platform and around RPA. So let me go ahead and do that now. All right. Fabian, you are make presenter, all you.
It helps to get off the mute button, right? So you're right? Is
That's
that correct?
Okay. Yeah.
All right. Awesome. So Jesse touched on a couple interesting terminologies there. And I want to make sure that I flesh out a little bit there. He talked about what a bot is. We're going to actually get into that in the next point. But before we get into that, he also talks about OCR and a couple of other technologies. So OCR is optical character recognition. That's basically taking what's our paper form and bringing that into something electronic. And bots is what we're going to get into next in terms of the robotics process automation. That's what he meant when he said RPA, robotics process automation, which we're going to jump in shortly. Another metric I like to have some of the metrics here for you to show you some value is that process excellence makes a difference. And in this here, we're basically in the world that I work in, even though I'm in an advisory capacity in a consultative role, working for an accounting firm, reduction in audit time is something that is important, right? Automation certainly helps you with that. And as an example, using an RPA technology, at least one institution here was able to save $2 million in cost savings by focusing on continuous improvement. Now, I'm a visual learner, and a lot of what we've talked about here today is talking about some disparate, items, but all packaged together under one ISV, being Nintex. But I thought it would be helpful just to show you basically the theme again: management, optimization, and optimization. And when I said before, you got to be able to have a plan to start out. You got to be able to map that plan in terms of documenting that plan, solicit feedback through sharing it and getting to know what those frontline workers think about it. In the case of healthcare, these could be your people inside of the emergency room, your administrators, your billing administrators, making sure the insurance is done correctly, your person that's in front that's taking the intake form, speaking to these people to make sure that what you're building is keyed in and relevant. And also, as things change within the organization, making sure that it's captured and solicit feedback in terms of making sure that we're doing things right the first time. Automation, we talked about the fact that in Jesse's example, you saw the ability to annotate and to work on a tablet and to collect information. So that's the mobile aspect of what's going on. Forms technology, forms should be very responsive. It should basically work the same way on your phone as it does on a tablet, as it done on a PC. Now, there is a divergence and convergence. I'm going to use them both here. So as you build in a map of your process, a process usually entails both people and system. A human being, I'm going to call a human actor, and a system actor. So basically an email being sent, a task being sent to you to perform, somebody saving something into a database, somebody saving something into a line of business ERP system for a patient record, and so on and so forth. That's a system working in concert with a human being. So when you're working in that fashion, the system is easy and predictable, right? You put something into a system, minus a power outage, minus a hard drive failure, minus something going wrong in the system, it is going to perform the same way over and over. And I'm going to remind you, when I said, okay, the stats about the human being in terms of being tied to our fingers in terms of data entry, and how a good day and a bad day can separate us being 100% on top of our game and less than 100%. Here's where RPA, or robotics process automation, comes in, because the world that we're living in right now is fundamentally shifting in terms of saying, okay, human beings are being taxed to do so many different things, and we pivot really quickly in terms of one activity to the next. So the ability to ensure that we are on the top of our game can be supplemented by using robotics process automation technology. And what you're going to basically do is basically task a bot to do that. Now, when I talk about bots to people, I sometimes say, make the analogy of, do you remember using Excel back in the day and you used to have a macro that can do something for you? Consider RPA basically macro on steroids, right? It's a little bit more than that, but if I needed to give a visual, that's the visual I usually provide. So now we're going to shift where we want to make sure that the human actor in these equations are basically now being called in to do a couple of things, right? We don't want to have mundane, repetitive tasks being done by the human. One, human beings don't like that. And in terms of efficiency and productivity, that's going to wane the more you have a person keep doing over and over and over again. So churn or busy work, wouldn't it be nice to offload that to a bot? That's where this industry is heading. That's what people are doing already. That's what we're trying to make sure that we talk to you about here today. And also, you may still need a human actor in that equation. Wouldn't it be nice to only bring that human actor in when there's an exception to the rule, right? So, for instance, is that there's a patient intake form, and the person took all of the information in. A bot is basically moving it from one system of record into another. Because there may be a difference in between those systems, but as it's doing that, it sees that, hey, this person's blood pressure is, let's use a weird number, 200 and something over 150, and that's really a red flag for under any situation. Wouldn't it be nice to have that bot say, hey, let's make sure that this is not a data entry problem, that the person didn't mean to type in something else, and we can have the bot flag a human being to take a look at that, and maybe it means a human person going back and actually doing putting the cuff on and doing another blood pressure, or using the stethoscopes to get heart rate and pulse rate, and making sure that that check is being done. So that's an example of how you can have a human being complementary into this situation, but only brought in for just a validation. And once you've done all of that and you can get your signatures, now it's time to monitor the health of it, to make sure that this is working fundamentally as you designed it, analyze it, and also improve upon it moving forward. And the bottom piece of it, any technology, whether it's Nintex or others, fundamentally needs to tie into other systems, whether it's an ERP system, a customer or a patient management system. Having that seamlessly work with the RPA tool or the workflow tool is certainly key and something that I wanted to emphasize here. I don't know, Michael or Jesse, if you had something to add to this, or maybe did I cover it with enough detail?
Well, I thought it was great. I think that the point, just to reinforce, is that it's not about replacing people. It's about focusing them on the tasks or the activities that add tremendous value, reducing errors and making sure you're focused on where it matters.
Absolutely, couldn't say that better. Thank you. So as we talk about focusing humans, and again, just to pivot this back into the healthcare, I have healthcare highlighted at the very bottom right-hand corner. But even within a healthcare institution, it's still a business, right? So that business employs people. So there's an opportunity for HR to have some automation. They're paying the people, right? So they're paying employees, they're paying the doctors, they're paying the nurses. When you have patients come in, they're also paying you, or the insurance provider is paying you as well. Finance is involved in that as well. Won't go through the rest of it, but you can basically see that even though we're niche to healthcare, where we're specifically maybe looking at appointment setting, we talked about that before in terms of the maybe the intake form, clinical trial management, secure data collection, pharmacy stock management, and the like. There's a tons of opportunities for robotics process automation. Now, when I say there that divergence and confluence, now's where I'm saying workflow and RPA can come back together. And now it's not an exclusivity. You're not saying, okay, RPA for this, workflow for that. Maybe like Michael said, it's better together, right? I want to basically complement the robots doing this task because it's mundane, it's repetitive. I want to make sure I have accuracy. And I also want to have a process that moves it from a person to a system to another person, and you have that process still built in. So the slide here, I'm not going to go through all of it again, you're able to read it as I speak to it, delineates those roles into the process type, the complexity, the types of drivers that you would key off, the environment that you'll be in, and the business impact in terms of what you're going to be able to basically realize from that. But the important and salient point here is that they're complementary. So what's a bot in the end, right? I mentioned we're going to talk about this. A bot is, if you consider it, I need to get something done, right? You as a human actor, how does this relate to you is a point I'm trying to drive across here. How does this impact you today? So you need something done. A designer is installed on your computer, and just like the macro example I gave with Excel before, where you'd open up Excel and basically mimic an activity, and then the macro would run it for you, it's the same concept. You basically will go through the same activities that you do as a human being, and basically that activity trains the bot. You're training the bot. The bot then, which is a virtual worker, takes the project and completes it. Now, in doing so, you train the bot can run, and the bot can basically run with you or without you, and I'll talk about that in a few seconds. But the linear process is that you're trying to get something done, so it's identifiable. You're going to design what that is by actually going through the task and training the bot, and then the bot takes over. Now that means that you can scale yourself, right? Because as a human being, you have one head, one brain, two arms, 8 fingers and 2 thumbs. That's basically your limiting factor. A bot basically just means spin up another computer, create another bot, and that bot now can work within all of your projects. Now, with that many bots, the way that most tooling, Nintex being no different, is that they have bots that can sit on your computer and work, and they have bots that can just sit by themselves and with the aid of an orchestrator or a scheduler, basically perform those activities for you. And that goes into basically the 2 different flavors of automation that are out there today, which is basically assisted and unassisted, or attended or unattended, depending on who you're speaking to. But basically, again, being on the complementary mindset, an assisted bot, and I'm going to give one use case, and maybe Jesse, Michael or Jesse can speak to their vision of this. Is that consider a situation where an intake person has a patient coming through them in an ER, and basically they're going to the human being is going to fill out some information, and then a person's going to come and check blood pressure, check heart rate, and they're going to key that information into a system. Now, when they're done that, a bot sitting on that very computer wakes up, takes that information, sanity checks it to make sure it's done properly, and already start to move in several different veins, going over to to the triage center, going make sure that there's a bed available, make sure that there's a practitioner available for them, and a bot can go out there and do all of that for you. So it's basically a human being handing off to a robot, and a robot does all of those other mundane tasks. An unassisted environment could be on the billing side of the fence. So again, with the healthcare industry, people come in there with insurance, and somebody has a copay, so you basically pay there on site. But now the part that needs to be happening from the insurance, that can all be automated. So again, you need to go ahead and key in medical coding. That can be done by a bot. The bot making sure that the person is authorized for that particular procedure, that can be done by a bot. And that can all be done unattended. It doesn't need a human actor behind it, because those rules are easy to apply, to define, and to move out. I don't know, Mike and Jesse, do you have any thoughts behind that in terms of how you guys view that in the Nintex world?
Yeah, well, I think that the what you called out, which is the flavors between assisted and unassisted, and the need for them to work together and then also be part of a workflow, is real key. I think the examples you lay out are you can run things that are somewhat independent or just sitting on a desktop, but the real power comes as it's connected to a broader workflow. And I think we see people using both those flavors, but pulled together into something that can be a little bit broader.
Excellent, thank you. I don't know, Jesse, anything, or we pretty much hammered it to death?
Yeah, no, I think it's exactly like what Michael just said. I mean, I think a lot of people now are starting to, look at an RPA solution as really just bridging that gap to the things that are on, the desktop, or things that don't have a web interface, right? That don't have an exposed API layer. It's just kind of manual enter, and then that kind of has to be picked up by something that is, web connected, or does have all those connectors already kind of built into it. So it's definitely bridging the gap. And then also too, you kind of hit on it before, it's really around like that manual entry. So anything that's kind of highly manual, anything that is just repetitive, right? That's where an RPA really kind of comes in, really, and kind of hits a home run, so to speak, because it frees up the users to be able to kind of go off and do the other things that we can't automate, or just is a lot more important.
Exactly. Basically, making sure that human beings are doing the imaginative task rather than doing the mundane, repetitive task.
Exactly.
So on the screen, I'm just going to I left this here so people can actually look at it as you were talking. These basically key back into the same things that we spoke about before in terms of what bots have as use cases. And one thing I wanted to show, again, the lower left-hand quadrant of this is showing you the healthcare system. These are, the people here today in the webinar are basically niche to the healthcare, and I wanted to ensure and show that a lot of the major players, Merck, United Healthcare, AstraZeneca, GlaxoSmith, Abbott, McKesson, and tons of others, that we couldn't fit into here today, are using automation, are using Nintex in terms of what they're doing around mapping the product, about creating the workflows, about using the RPA technology. But not only them. Again, technology, manufacturing, government, tons of people are using this technology. It is relatively new from an analyst perspective in terms of analysts carving out this space and start to look at best of breed. And I'm pleased to say that Nintex is ahead of the game in terms of that, in terms of the visionary aspect of it. But wanted to make sure that I showcase this from a logos perspective in terms of different logos of people out there that are using this today. And I want to end, I know, Rachel, we have like 10 minutes left before we do, but want to jump into the polling questions right now so we can capture that before we jump into a quick Q&A?
Yep, definitely. So here is the first. So does your organization or business unit you operate in currently do any process automation? Give everyone about a few more seconds, sorry.
I think we have like yeah, a couple more seconds before we jump to the other one.
Yep.
Yeah.
All right, I'm gonna close it out.
And let me move to the other one.
Can you identify processes now that are a candidate for automation? All right, I'll do a few more seconds. Go on to the third. Do you believe that mapping your systems and processes is a useful activity in your organization? A few more seconds. And we'll go on to our final question. How soon are you thinking of investing in process automation? All right, we're gonna close that one out.
All right. So this allows us to pivot into the Q&A section. There we have like, let me see, 2 was on display. Hopefully you were able to get back in. So that's fantastic. I missed what you said about getting the CPEs. Rachel, can you speak to the CPEs piece of it again, please?
Yes. So if you answered these 4 polling questions, then you will be granted the CPE credit for the hour, and we will distribute certificates to you in a few weeks.
Awesome. And our hospital deals with multiple grants. Will this something that can be beneficial? And there's meant to say something beneficial to us, exactly. So it was a follow-on to the first one. So absolutely. So as I mentioned before, in a very casual example, I say that no human can escape a process. The fact of you waking up, freshening, going in a car, going to work, that's a process. When you go to work and you perform a function or an activity, that's also a process as well. So from a grant system, multiple grants, the way I could see this happening, and let me take it from the very beginning, from the mapping perspective. If you can map and document the way that you receive those grants, and then what happens to those grants once it comes into the hospital system, and how you basically either whether you are providing these grants to others, or you're basically funding a certain program, or you do some research, you can map that process. And from mapping that process, you can now define a workflow behind it in terms of also the reporting, in terms of how you use this grant and how the grant provided benefit to either your research or to certain applications. So I can think of a gajillion ways of how this could be beneficial to you, from a mapping, automating, and also having a bot, do the reporting piece of it. So I think that's fantastic. If there are more questions, you can jump in, and I'll open up to Michael.
And I just to maybe I'll tee this one up for you, Fabian, that kind of came in. I'll try to consolidate a couple of them, which is around, I think, some of the benefits that people have seen, very particularly in healthcare. And so maybe you can comment a little bit on some of the quote unquote the ROI or the benefits that you've seen.
Right. So from a healthcare perspective, the ROI that I've seen is several different ways, but I'm going to key off some important ones. Now, we showed ROI in terms of just efficiency and efficiency of payment, and I think that was important, especially in the medical industry, because you have a bunch of people doing ICD-9, IDC-10 coding off on these medical systems, so they're trying to find out what people are authorized for and what their insurance are going to pay versus what they need to pay. Having a bot do that certainly reduces errors in admissions, and also having a bot provide the request for payment in an efficient time and efficient manner allows it to happen. Now, what you should consider is that, again, human beings work in shifts. A bot can be there 24/7. And these systems that are allowing electronic systems to speak to each other allows for that, right? So you can basically do iterative, or you can do batches, and you can actually have that bot do that at all hours of the day. Typically, there's 8 hours of the day that no one's doing any work in terms of a human being, right? Even if you have shifts, there's always that 8 hour that there's no activity. You can have a bot cycling 24/7, and that's one key thing. Another way is PII and compliance that I've seen ROI in. So a compliance officer, in terms of having a person review tons of record, efficiency was gained by actually having a bot to do that before and flagging things, and that can also be used for risk mitigation as well. So we were able to show ROI there, measurable ROI in those areas.
Yeah. Well, and then this is probably a softball for you, Fabian, but I saw this one come in as well, and maybe Jesse could probably comment on it as well, which is just like how long. I just saw the poll question around when people are looking at doing projects. How long do you see organizations take to get up and running? I think that there's kind of a question around is it complex, is it hard?
Right.
Things like RPA or things like process automation generally.
Absolutely. I'll tell you what, I'll let Jesse jump on this one to just be mindful of time, and then I'll jump in.
Yeah. I think, for me, coming from the customer side of things, right, being in that seat, so to speak, building it out, tools like Nintex, it's definitely, at the matter of days, it's not a matter of months to get up and running and start seeing that ROI. Kind of once you have something built out in your mind, you kind of put it to pen to paper, especially tools like Nintex ProMap, where you can actually, collaborate and kind of refine things over time. The automation piece is just almost like a byproduct of it at that point, right? You already have the blueprint with ProMap. Now you get into a tool like Nintex Workflow Cloud. It's all drag and drop. To be able to build a process out is a matter of days. I mean, sometimes even hours to be able to get things up and running. So you can definitely see that pretty quick, and it's not very technical heavy, right? To be able to get that baseline process out.
Indeed, and I'm actually on 2 active projects right now with my team, and we are rolling out one right now. I think we have the project is slated for 2 weeks, and we're coming in on their time and within budget. So I could definitely attest to the days, not weeks, type of answer for that as well. We'll actually field the rest, and we're like coming up right on the top of the hour right now, and there's no more questions coming in. I want to be respectful of everyone's time, so I want to thank both Michael and Jesse for taking the time to come here today to do this webinar. Thank you, Rachel, as well, for sitting through being our moderator. And if you do have any questions, please reach out to us, via the channels that you have available to you, and we can certainly answer more questions to come. Thank you.
Thank you all so much. And please remember to take a moment and complete the online survey. We'll be sending out an invite shortly for our next webinar. Thanks and have a great day.
Thanks, everybody.
Thank you.